Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
H1N1 Influenza. Introduction. H1N1 flu, also called swine flu, is a respiratory disease of pigs that is now spread to humans. Swine refers to animals such as pigs, hogs, and boars. Flu is an abbreviation of influenza. H1N1 is the name of the virus that is spread to humans. Cases of humans infected with the H1N1 flu virus have been reported internationally since 2009. This health education program explains what the H1N1 flu is. It discusses its symptoms, when to seek medical help, and its treatment options. It also provides important prevention tips. About viruses. Viruses are very small living particles. Viruses are made of an outer shell that protects genetic material packaged inside. In order for a virus to reproduce, it needs to enter a living cell by attaching itself to the living cell's surface. Viruses tend to infect only specific cells in a specific species. For example, certain viruses may only attack human cells, while others can attack only bird cells. Once inside the cell, the genetic material of the virus blends with the genetic material of the infected cell and copies itself hundreds, if not thousands of times. The hundreds of copied viruses then kill the cell, burst out of it, and infect many new cells. The cycle repeats itself and can make a person very sick unless the person's immune system destroys the virus. When a virus is copying itself, the genetic material of the virus can go through changes, known as mutations. The virus can also exchange genetic material with the infected cell, which can modify the surface of the virus. This may make it possible for the virus to attack the living cells of different species, such as pigs and humans. A virus modified by mutation is known as a different strain. There are three types of influenza viruses: A, B, and C. Types B and C are usually only found in humans. Type A can be found in both humans and animals, such as birds, pigs, horses, whales, and seals. Influenza and COVID-19 are both contagious respiratory illnesses, but they are caused by different viruses. COVID-19 is caused by infection with a coronavirus, while the flu is caused by infection with one of the flu viruses. H1N1 flu infections. Influenza viruses happen naturally among pigs, hogs, and boars. Swine influenza is very contagious among swine. It can make some domesticated pigs very sick. In the past, humans rarely got sick from swine flu viruses. People occasionally got sick from contact with infected pigs. Catching the swine flu from another person was rare. H1N1 flu is a mutation of the swine flu that affects people. It has become a regular, seasonal flu virus that people can catch. It may continue to circulate for years to come. Flu viruses are spread mainly from person to person when infected people cough or sneeze. Sometimes people may become infected by touching something with flu viruses on it, and then touching their mouth or nose. There is no evidence to suggest that you can get the H1N1 flu from eating cooked pork. Infected people may be able to infect others beginning 1 day before symptoms develop, and up to 7 or more days after becoming sick. Children, especially younger children, might be contagious for longer periods.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Symptoms. The most common symptoms of H1N1 influenza in humans are similar to typical human flu and include fever, cough, sore throat, body aches, chills, fatigue. Some people have reported diarrhea and vomiting associated with H1N1 flu. People who have chronic conditions such as asthma, diabetes, congestive heart failure, etc. may notice a worsening of their medical conditions.
You cannot tell the difference between flu and COVID-19 just by looking at the symptoms alone because they have some of the same symptoms. That's why testing is needed to tell what the illness is and to confirm a diagnosis. Testing is also important because it can reveal if someone has both the flu and COVID-19 at the same time.
Emergency signs. If you have severe symptoms, your doctor can test if your flu symptoms are caused by a flu virus. This section discusses when you or your child should seek medical help. You should watch for flu-like signs. These signs are fever, body aches, runny nose, sore throat, nausea, vomiting, and diarrhea. Signs of the flu are often mild and do not require medical evaluation in the clinic. When the symptoms are mild, it is important to keep yourself hydrated, get plenty of rest, and practice good hand hygiene. You should seek medical care if you or your child develop any of the emergency warning signs. Some of the emergency warning signs that require urgent medical attention are listed next. In children, some emergency warning signs include fast breathing or trouble breathing, bluish skin color, not drinking enough fluids, high or prolonged fever. You should also seek immediate medical attention if you notice changes in your child's mental status, such as not waking up, not interacting, extreme irritability and not wanting to be held. In adults, some emergency warning signs that need urgent medical attention include difficulty breathing or shortness of breath, pain or pressure in the chest or abdomen, sudden dizziness, near fainting or fainting, confusion, severe or persistent vomiting, high or prolonged fever. If you or your child have flu-like symptoms that get better but then come back with a fever and a worse cough, seek medical attention as soon as possible. When you arrive, tell the receptionist or nurse about your symptoms. You may be asked to wear a mask and sit in a separate area to protect others from getting sick. Treatment. Which treatment is appropriate for you is based on the severity of your illness. Your doctor may consult with an infectious disease specialist to determine the best treatment. Certain antiviral drugs approved for human influenza viruses may work in treating H1N1 influenza infection in humans. Antiviral drugs are prescription medications that can help treat the flu by keeping flu viruses from reproducing in your body. These include pills, liquids, or inhalers. Antiviral medications are currently recommended only for those patients with moderate or severe illness from H1N1 flu. Most people get better without antiviral medicines. Antiviral medications must be taken within 48 hours after symptoms appear. They may diminish your symptoms, but they may not make your symptoms go away entirely. Other flu treatments that should work for H1N1 flu include rest, medications to bring down a high fever, and drinking plenty of water. If complications happen and you become very sick, hospitalization may be needed. Hospitalized patients may be given oxygen or use a respirator. Children or teenagers with the flu should get plenty of rest and drink lots of liquids. The medicines that they take to relieve their symptoms should not contain aspirin. Never give aspirin to children or teenagers who have flu-like symptoms, especially a fever, without first speaking to your healthcare provider. Giving aspirin to children and teenagers who have influenza can cause a rare but serious illness called Reye syndrome. Prevention tips. The seasonal influenza vaccine usually includes the H1N1 influenza strain. You only need one injection to prevent flu. An option for vaccination that doesn't require an injection is the flu nasal spray. It is sprayed in the nose. Flu vaccines are safe for pregnant women. Pregnant women are urged to get vaccinated with the seasonal flu vaccine, but women who are pregnant should avoid the flu nasal spray. The following people should also avoid the flu nasal spray: people with asthma or a weakened immune system, people who use aspirin therapy, people who are allergic to eggs, people younger than 2 or older than 50 years of age. The following tips will help you prevent flu.
Wash your hands often, especially before eating and after sneezing or coughing. Scrub your hands with soap and water for at least 20 seconds and then rinse them.
You can also use an alcohol gel product available over the counter, which is also effective in protecting against flu. When you cough or sneeze, cover your mouth and nose with your elbow or sleeve, or use a tissue and be sure to throw away the tissue after use. Wash your hands after you sneeze or cough. Try to avoid close contact with sick people. Avoid touching your eyes, nose, or mouth. Germs spread this way. Try to stay in good general health. Get plenty of sleep, be physically active, manage your stress, drink plenty of fluids, and eat nutritious food. If you get sick with the flu, here are some tips to avoid spreading the disease to others. Stay at home and avoid contact with other people. Cover your nose and mouth with a tissue when you cough or sneeze. Put used tissues in a wastebasket. If you don't have a tissue, cough or sneeze into your upper sleeve. Wash your hands every time you cough or sneeze. Alcohol-based hand cleaners are also effective.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. H1N1 influenza or swine flu is a contagious disease that is caused by the influenza virus. Infection with the H1N1 influenza virus can result in severe illness and life-threatening complications. Symptoms of H1N1 flu are similar to those of the common flu. Resting and drinking plenty of fluids usually allows infected people to recover from the flu. For people at high risk of developing flu complications, medications and hospitalization may be needed. The flu is best prevented by getting the influenza vaccine. Other things you can do are avoiding close contact with sick people and washing your hands frequently. If you have the flu, you can help stop the spread of this infectious disease by staying home while you are sick and by covering your mouth and nose as you cough or sneeze. More information about the swine flu can be found at the following website: www.cdc.gov/flu/swine flu/index.htm. Thank you for using Explain.